Hi everyone, I want to talk about a huge problem I see in healthcare all the time, and that's the problem of polypharmacy. If I had $1 for every time I look at an elderly patient's medication list, and my jaw literally drops when I see how many medicines they are on. I kid you not, sometimes it's literally 50 different pills they are taking every day. I believe this is so common for a number of reasons, including the fact that as people age, chronic conditions pile up and they start seeing multiple doctors who prescribe different medications. Now, don't get me going on our primary care system, which I believe is completely broken. That's a whole different conversation. I could go on for hours about that. But because our healthcare system is so fragmented and encourages pill popping, before you know it, that patient's medication list has spiraled out of all control. It's literally exploded. One of my heroes and one of the wisest men who's ever existed, Benjamin Franklin, once said, "The best doctor gives the least medicine." That's very true. By the way, if you ever want a compendium of some of the best quotes ever written, go online and read some by Benjamin Franklin. They can also be hilariously funny as well. But coming back to our polypharmacy culture, if you think your grandma or grandpa, or even your parents or anyone else you know is on too many medications, here is what I encourage you to do. Find a de-escalation doctor, You need to find a good generalist, usually an internal medicine doctor who can spend at least an hour going over their full medication list and working out what can be de-prescribed and changed up. In my opinion, there's usually lots of things. For instance, one blood pressure pill hasn't been maximized before trying another one. A medication that didn't work hasn't been stopped. A medication for pain or discomfort has been doubled up with a different one when likely only one is needed for better relief. De-escalation of these massive polypharmacy lists is not only good for any patient, reducing interactions and side effects, but also good for reducing personal and overall healthcare costs, a huge deal. This is one of the biggest areas for improvement in how we manage, especially elderly patients, and we can do a big thing here to promote their overall well-being and strength. I encourage everyone listening to be a big advocate for and speak to more doctors about de-prescribing what is not necessary. Thanks very much for listening. I will see you next time.